Hello, folks. This is Seven Song, and this is uh, the final, what was to be a one and a half hour class. This is now part three of it, and I imagine it will be about another hour and a half of it. But I'm just going to go until I finish my notes. Well, I'll stop at 2:30, at 3 o'clock, excuse me. So to start off again, basically what this class is about how to perform or how to conduct consultations. It's actually been a lot of fun. Um, It's been very interesting for me in a good way, learning. Um, it's been very interesting. Sorry, I was distracted for a minute. It's been uh, it's been educational for me making my notes about what it is to be a good clinician. I think about it all the time. Frankly, I probably think more about how do I make an appointment with somebody? How do I make a consultation with somebody, feel comfortable with them, but still be truthful? Today, we're going to move right into that second aspect, how to be truthful, after I finish like my introductory spiel. I can announce for my first time um, that I'm pregnant. No, I'm not. I'm 67 years old. I'm way too old to be pregnant. That I'm going to be putting my database. I've been working on an herbal database for about 4 years now. I started with COVID, and it's going to go live on March 30th. It's going to be not even close to complete. There's so much more to do on this, but I keep stalling. And the reason I wanted to do it in a database form is so I can just keep adding information. I'm not a writer, or I'm not a book writer because I always change my mind about how herbs work. So on a database, I can alter it. I'll be writing more about this. And you don't have to be there on any kind of opening day. I will not be cutting ribbons or breaking champagne bottles on the keels of boats. But it is exciting. Me and my tech guy, Steve, finally have it together enough. So you'll be able to access this database. And just very quickly about it, the reason I started it is when I'm in the clinic, often I just get stuck using the same plants over and over again. And I just needed something like to expand. So if I'm thinking about anxiety, I'm just thinking about the same 10 plants, I can just go online for myself and type in like anxiety and see all the herbs that I constantly forget. But since then, it's ballooned out into a much larger project, giving lots of suggestions and wildcrafting ideas. Anyway, that will be online in just a few weeks. I'm pretty nervous about it, frankly, and excited. Um, let's see. If you're interested, if you have questions that I don't answer today, or if you're interested in other free classes, the database, by the way, will be free as well. You're welcome to ask, but I would suggest I'm going to set up a page on Facebook and Instagram, the two social medias I'm a part of. And I'll just like after this class, I'll just say if you have suggestions, post them here about further classes or questions that you've had about the classes I've given here, and I'll try to answer them. So that's the introduction. I'm talking to you from Ithaca, New York, where spring is slowly burgeoning, as it probably is for where many of us live, which is fantastic. So the beginning of today's class is a continuation of part two, and it's about working with complex cases. By complex cases, I mean they could be awkward situations or, just not straightforward. Like somebody has a problem, their problem is evident. Maybe their labs say it's evident, and then you move towards treatment. Oh, by the way, this class is not about treatment or diagnosis. It's about the consultation. So I want to be really clear that I have a person with specific beliefs, right? And my beliefs tend to be pragmatic and more scientific. The reason I'm saying that now is because in talking about complex cases, there are kinds of diagnostic techniques that I don't think are very helpful. There are treatments that I don't think are very helpful, but some of you might. My goal is not to chase anybody away, but I am going to stay within my lane of what I'm comfortable treating and what I work with that I consider valid diagnoses. So in other words, some of this will be contentious. So here we go. So The first thing about these complex cases is, what do you do if you disagree with somebody's diagnosis? So a very common one and a very tricky one for me, for instance, is Lyme disease. So Lyme disease exists, long-term Lyme exists. None of those are questions for me, non-controversial to me. But people will come in and say they have Lyme, and their symptoms are fatigue, muscle pain, memory loss, um, inflammation of joints, alterations of eating habits, brain fog. These things, these symptoms in particular, are very common for hundreds of different healthcare problems because it's what our own body does when it gets a virus. So what I want to do, I'm not suggesting these are not people don't have Lyme. Many people. I live in upstate New York. Lyme is common here. But what I want to talk about is what you do when you disagree with the person's diagnosis, and how to move forward with that, and hopefully maybe helping in the end that that person feels empowered rather than disempowered, even if you have disagreements. So I hope this makes sense. I'm going to keep going with it. So the first thing is, if somebody comes in and I disagree, if I think their diagnostic is not what's wrong with them and it doesn't seem to be harmful, so they say they have an illness or a health condition, and I'm not sure if it's the right one. If it's not harmful, I don't say anything. There's no reason to disagree. There's no reason to make the person feel uncomfortable. So in that situation, I just I just keep moving forward. So they say they have these issues. These are some of the things that they've been diagnosed, often without labs. Labs are expensive. Labs are not always excellent diagnostic techniques. And then we keep going. What I want to say, though, is what happens when you disagree with your diagnostic and you think it's harmful or at least not helpful? So they're telling you something like, I think I have Lyme. Again, Lyme exists, but you're unsure that it's Lyme because, let's say, they haven't been bitten by a tick, they don't live in an area that has Lyme, or really any other disease, is what to do. And so this is what I do in these situations. I would say to the person, I first want to validate. I hear your symptoms, and often I'll say their symptoms back. We talked about paraphrasing previously. So I'll say to them, I hear that you have fever and you have headaches, you have difficulty with memory, you're not sleeping well, and other symptoms that they have. And then I'll say, these are symptoms of many diseases. But here's the important line of this whole thing. So I'll say, you may have Lyme, but I want to be sure because the treatment has to be correct. So for instance, if I don't think it's Lyme and I think it's something else, I want them to know that the importance of me finding out that they have Lyme or not is not whether to agree or to disagree, but I want my treatment to be helpful for them. And if their problem is from, let's say, a concussion from falling off a bicycle causing those symptoms, then my treatment might be very different than if they have Lyme. So this is the beginning of dealing with complex cases. This is really common. People come to see herbalists who can't get a positive diagnostics. Often they're making up their own diet. They're not making up. They have read, they've researched, and now they're coming with diagnoses. And this whole section I'm going to be talking about is what to do in these situations. So the next aspect of this is what to do if you feel like the diagnostic method is inaccurate. So the first one is, I'm not sure the diagnosis is correct. The next one is, what if the method they're using to diagnose themselves, you feel is not an excellent way for them to know really what's going on, what the underlying problem is, what their health condition or illness is. And again, it's the same thing as many of these are. So if they're using a diagnostic method, so for instance, I know people are going to not like this, I'll just go with it. So I don't believe that the kind of muscle testing that people does will give an accurate diagnosis. If there's a problem for you, I'm just going to keep moving forward with it. So there are ways, there's questions to ask, there's labs to take, there's people who can evaluate well. So if somebody comes in using a diagnostic method that I think is not the best way of diagnosing their health condition, what I will do is not really talk about what I don't think is effective. I'll just suggest other ways to help diagnose. So I might say that might be that you have a head injury from your bicycle. Other ways to diagnose this would be go to a physical therapist or go to get an MRI. If I do this, I'm also going to let them know that these things cost money, right? And often are not covered by insurance. So I don't want to say like it's easy to just make an appointment and get a head scan. It's not easy and it's expensive. But my point here is more to say that if I feel like the diagnostic method is not that accurate for their condition, I want to make suggestions um, for diagnostic methods that I think will be helpful. And all of this, everything I've said, like the past 3 classes, all come down to this. I want to help them. And in order to help them, I need information that helps me assess their problem and then to set up a treatment protocol. Next, in the same line. So what do you do when you disagree or feel uncomfortable with somebody's treatment orientation? This gets a little more problematic for me. So, for instance, people often want to do parasite cleanses for a very wide variety of health conditions. Some of these parasite cleanses contain pretty strong herbs and I think are unhealthy for a lot of people. So if somebody comes to me and they say they have whatever health condition they have and they're doing a parasite cleanse, and to me it seems like it's making them weaker, it's making them foggier, it's causing weight disruptions in them. At one point, I feel like it's important to say something. For instance, probably the one time I was working with somebody who had a lot of knee pain, and she was using the book, The Cure for All Diseases. For me, a book that's called The Cure for All Diseases is quite a very big red flag, right? There's only one cure for all disease, and we probably know what that is. That's called the end of life. So, um, so she wanted me to make a parasite cleanse based on this book, The Cure for All Diseases. And I wouldn't. I just felt like it was harmful. This is not very common for me. I can usually have a discussion, but this is exactly what she wanted. And so she fired me. I mean, that's how we say this in terminology. I was the wrong herbalist. Again, in my 19 years, the clinic, that hasn't happened often. But I think at one point we have to make a strong stand and say, I don't want to be the person giving you herbs that I think will do harm, right? Sometimes it's nebulous. People will want things that I think are not perfect for them, but it offers them agency. Placebo is a real thing. So if they think that, I don't know, mullein is good for a foot pain and they really want it and it seems not harmful, maybe I would include it. But in general, I want to give herbs that I think are going to be helpful in whatever ways for their health conditions. So that is almost the end of this whole contentious thing. By the people, was that helpful at all? Does that make sense? Do you ever find these situations yourself that you are in? You can thumbs up, thumbs down, thumbs sideways. So again, my goal is to be as helpful as possible, but herbs are real things and they can do harm to people. And I think one of the ways that we can reduce harm is by helping people understand their health conditions, by helping people look at the way they assess themselves and treat themselves. Next. One thing that's pretty common is people coming in with health conditions that I don't think herbs are going to be helpful for. I'm going to give you some examples. All right. It doesn't mean we can't try to give herbs, but herbs are not the answer for everything. Just on a very simple level, often people have a lot of body pain where I think massage therapy would be a much better choice, or some kinds of gentle chiropractic. So I think sometimes people hold a lot of tension in their body And it might be certain exercises or massage or something else that will be helpful for this. And so we have to be clear and let people know that herbs won't cure anything. So the most common for me is cancer. So people will come in and they'll discuss like their stage 4 cancer, whatever the cancer is, or stage 3 cancers. And these are the things that I feel like we can do. There's other things too. Like I found often tinnitus or tinnitus can be very difficult to treat with herbs. There's really a number of situations. There's some congenital health issues that people have, certain kinds of dystrophies or muscular dystrophies, that I don't know if herbs are going to stop the progression, but here's what we can do. So this is what I want to spend a few moments on. So the first thing is we could be honest and transparent. We can say, I haven't treated this. I've heard that it can be helpful, or really saying, I'm not really sure how helpful herbs can be. So let me give another specific example. Not that many herbs bring down very high blood pressure. So if you are hypertensive and your numbers are like 180 over 100, the herbs that bring down those very high numbers, they're called cardiac glycosides, are kind of risky. And it's hard to know if your preparations are going to be safe for the person. So for me, if the person's very hypertensive, has very high blood pressure, I think medications, meaning pharmaceuticals, might be in order. But what can we do? We can do a lot. We can help make the heart muscle a better functioning muscle. We can increase cardiovascular tone. We can help blood vessels be stronger. So that's just the beginning. If people have a lot of other health issues, again, if people have cancer is a very scary diagnosis. So if somebody comes in, I say, well, I don't know any herbs that are going to shrink these tumors, but we can just be active listeners and listen to their health concern, which in itself can be very positive. Um, we can help with any anxiety or depression associated with it. I mean, when you get a diagnosis like this, it doesn't help increase one's sleep, right? So we can help with insomnia. No, potentially, I should say potentially before all these things. If it's causing pain, we might be able to alleviate pain. If people are having a lot of brain fog because there's a lot of new information and it's putting them in a state of making it difficult to think. So when people come in to see us as herbalists with health conditions that we feel cannot be addressed by either our skill level or they need to see something, another form of medicine, I think there's many things we could do to support them. And I just really want to be clear. The things that I said, basically, it's not like cancer. It's a person with cancer, and that person will have other issues involved in their life. And that's where I work. I know there's some herbalists who specifically work with cancers, but I'm not one of them. I'm a support person for people with cancers. I really like a lot of congenital uh, health conditions like various kinds of muscular dystrophies. We might be able to help with tightness, but they would also have to do other work as well. All right, next. This one's a little tricky. What to do when you give herbs and it makes their condition worse? Um, this is going to happen. If this not happen, you probably haven't practiced for a long period of time. You haven't practiced a lot. Eventually, you never know what. I mean, I had a patient once got vomited from astragalus. I have never heard of this, but it happened. Just the other day, I gave somebody herbs to help them with sleep. It kept them awake. It wasn't valerian, very surprising. So what I want to do now is discuss a couple of ways what we can do if we give something and it makes them feel worse. Here's the first thing that I think we should do. Take responsibility, right? Don't pull any kind of healing crisis crap, right? It's not their fault. It's not your fault. This happens in the world of healthcare. You start to see people that have serious health conditions and things are going to go wrong at times. So the first thing is when the person says it, you know, these herbs made me feel really bad. First thing I'm going to say is, I'm really sorry that that happened. Um, And probably one of the next things I'm going to say, and this is true for me, is thank you for telling me, right? Because we're all going to learn by info, right? That's how we grow as people. That's how we grow as practitioners. So when that person back and said, that really, these herbs really kept me awake, I thanked her and sincerely because I was like, I haven't seen this before. And now I have more information that can help me in the future. So next, so again, this is a list of things I think you can do when we give herbs and create flare-ups or worsenings of conditions. The next is not to deny their reality. So if they say, I took hops tincture for my anxiety and I think it's making me worse, I would say it could be, right? It sounds like it's making you worse. I mean, it might not be, right? It might be part of a formula. We'll get into this a little bit. But the point is, I want that person to feel heard and I want to make corrections. So one of the next things that I'm going to ask this person is, are you still open to herbs? Right? And if they are, if they come back, they probably are. So are you open to herbs? What I want to do now is stay in this realm and take it a step back. Every time I give people medicines, I always tell them, if you have adverse negative reactions, if you had adverse reactions, please let me know. So in a sense, I'm setting them up. Again, I'm going to say this again. When I give somebody, it could be as simple as echinacea. It could be a tincture for their Lyme or for memory problems, gynecological aids. Doesn't really matter what it is. If I'm giving somebody a medicine, either internally or externally, I will let them know that people have individual reactions to herbs. And if they do, just let me know. And then what we usually do, you can't really see it because I'm not in my office, is we open the cabinet and we have hundreds of tinctures. It's a visual that says, if this doesn't work, we have a lot of different options. So that way, we're opening the door early on for them to realize that if they don't feel well, to come back. This also sets up probably a precedence of them being nervous to take something, but I'm going to still do that, right? I mean, that's the problem when you say to somebody, this may make you feel bad, you're kind of putting the kernel in there that it might. On the other hand, I'd rather that kernel was in there, and if there's an adverse reaction, they will stop taking it and come back to see me if they want to. Um, so if they've come back and the herb didn't help, the next thing to try to figure out is what happened. So this is difficult when you give formulas, right? So if I give somebody a formula with hops, valerian, kava, and skullcap to help them sleep, and they can't sleep, it could be any of those 4 or 5 herbs. Valerian is the most notable one to cause that problem, but who knows? People have idiosyncratic or individual reactions on a regular basis. So first question is, what herb might it be? One way to know is you can ask them if they've ever had negative reactions to any of the herbs in there. Most people haven't taken herbs regularly, so they might not. But that's going to be your difficulty, is trying to suss it out. The next thing is, was it the preparation that was the problem, right? So for instance, if you give somebody a tincture, it has alcohol in it. The alcohol itself might make people feel uncomfortable or nauseous. So I've said this previously, I'm going to say it now just to be very clear. Every time I give an adult a tincture, I always ask if alcohol is acceptable, every single time. You have no idea who has trouble with alcohol and who doesn't. So it's always like, this tincture has alcohol in it. Is alcohol okay? And if they say no, then we have glycerites and capsules to fall back on. Those are the things we have that are not in alcohol. One more thing to think about, though. So the preparation didn't help them. They've come back. And the question is it the action of the herb that was a problem for them? For instance, let's say they take a tincture that has echinacea and they have an autoimmune flare. So echinacea sometimes causes that, but sometimes herbs that have interactions that are anti-inflammatory could potentially cause a flare, though normally they do the opposite. So in other words, when you're looking at it, you think about, was it the herb? Was it the preparation, or was it the type of, was it the action of the preparation? Was it anti-inflammatory or anti-anxiety or antidepressing? And is that the problem? Like you're hitting the wrong direction, and that's putting their health into a different state. Does that make sense? Uh, it's weird to say that makes sense to a computer. To a computer, does that make sense? All right. The computer is nodding some heads. Thank you, computer. All right. So my next section is about talking about building a bridge. First, take a sip of tea. Look at all the deer outside, getting ready to eat whatever I try growing in a few weeks. Oh, they're not there. They'll be back. All right. So now we're going to talk about being a bridge. I think it's a little self-aggrandizing here. What I think I do well as an herbalist, as much as anything, is having understanding of the medical world, the pharmaceutical world, the conventional medical world. I don't use the word allopathic. I just don't really care for the word allopathic. Also, it doesn't really fit for many people. So I spend a good amount of time trying to understand different diseases. What is Lyme? What is muscular dystrophy? What are the causes of headaches? What causes bronchitis? What's the pathology sitting underneath that? And then trying to understand different categories of medications, antidepressants, thyroid medicines. Um, what I would suggest, if this is you, is don't try to study all of them. Study the ones that hold your interest, or if you're actively working. So recently I got some functional labs from a person I'm working with for their thyroid, and there were some of the lab values I just didn't know well, and so I just had to study those labs. So what I'm suggesting is not like going in and trying to understand all pharmaceuticals and all health conditions. What I'm suggesting is if you have an interest in heart medicines, in thyroid medicines, in biologic medicines, study those, because if you have an interest, you will study better. If you're working with somebody and they're having seizures and you're looking up seizure medicines, or they're having mental health crises and you're looking up antipsychotics, it's just trying to understand them a little bit. Not so much what exactly they do, because we can't mimic that, right? Like if we say a drug like Lexapro is an SSRI, that's helpful kind of knowing what SSRI means. But actually, we don't really know what herbs are selective serotonin reuptake inhibitors. But at least we get a sense of what the groupings of these herbs are. The antidepressants, which are often anti-anxiety herbs, for instance. So what I tried to do, some of this fit under the herbal education that I covered a while ago. What I try to do with people is help them understand what their how the medical world sees their condition, and if that differs from how I see their condition. So what will that look like? It really just depends on it. The most common thing that I discuss with people is diabetes, mostly type 2 diabetes. Almost everybody I know with type 1 diabetes has a pretty reasonable understanding of what it is. And the reason, this could be a 1-minute description, right? To describe type 2 diabetes, you could say sugar in the blood causes inflammation of blood vessels, which harms tissues around those blood vessels. You have smaller blood vessels going to your eyes, going to the penis, going to your feet, that often can get harmed by this sugar in your blood. So if you have diabetes, the sugar is staying in your blood. In other words, that's a reasonable explanation, and it just says why diabetes is such a big problem. And then it depends. Like that's a very simple one. Other people have lots of knowledge. So it really doesn't matter. It does matter. What matters is if you understand their condition and help them understand why they're getting headaches, or why they're having what's going on with herniated discs, or what's happening with erectile dysfunction or drop foot syndrome. I don't know, it gives them agency. It gives you credibility, and credibility is helpful, right? I mean, we're going to be giving these people wacky, weird tasting stuff. So you're building up some credibility in this area. So this is just really common for me. I don't bluff. If I don't really know something about, if I don't know something about their disease, I'll not bluff about it. But it often, lots of things fall under the same rubric. And so then there's lots of ways uh, to discuss it with it. I'm going to sum it up. The more you understand about modern medicine, often the better you can communicate it with people. Like if you have a very big understanding, it's often easier to refine it. And by doing it, it helps people believe that you understand their health problem. And also it helps them understand their health problem, which potentially gives them more agency. This is not something for they're going to throw back in their doctor's face. This is just for them to understand it. And then the language makes more sense. The other thing that's helpful is then you could also make recommendations, right? So you might say this kind of scan is helpful for this. This kind of physical therapy can be most helpful for this. Massage could be helpful. Acupuncture could be helpful. So understanding the various modalities allows you to make choices it allows you to offer choices for the individual. Um, Yeah, unfortunately, many things, for me, need lab. Like if somebody thinks their thyroid levels are off, it's only labs. Like I don't really know any other way you're going to know if somebody is clinically hypo or hyperthyroid without just checking like 4 or 5 basic labs. So part of this is also just discussing costs with people. Depending on their insurance, some of these labs could be less expensive or free. I'm fortunate that I work in an integrated free clinic. So what I would do is I would recommend they see our clinic coordinator who have better ideas. We might not be able to get them anything for free, but you'll have better ideas of, can we get these medications cheaper? Can we get these labs less expensive? So, and it can be important. For instance, if somebody has a really serious infection, um, echinacea, I don't know, wherever you live, let's assume echinacea is like $10 for a 1 ounce bottle. For me, many serious infections, maybe a respiratory virus, you're going to go through a bottle of echinacea, a 1 ounce bottle, within 3 days at the most. What you want to do is hit hard and hit heavy in the beginning stages. Whereas antibiotics, so in New York State, there's a list of antibiotics that are $3 for a month's supply. And so it could be less expensive for them to get the antibiotics. I understand that antibiotics are not the cure all, that we take them too much and it's creating resistance by bacteria in our body. What I'm trying to point out is, weirdly, sometimes medication is cheaper, especially if they have insurance, and you just want to stay with it. You want to let them know. It's a little bit different for me. I work in a free clinic, so all the herbs are free. But for many of you, that's going to be unaffordable to be able to give those herbs for free. So knowing like how much certain medications are when they go off brand, you can get generics to help people. And also sometimes counseling is what people need. This can also be expensive, not readily available. Like there are in Ithaca, New York, we have less expensive mental health counseling, but often there's a really long line. And so it'll be a while before they can get in there. But I mean, I'm sure all of us see people, or all of us have health issues that are not resolvable by drugs or herbs. They need somebody to talk to and get feedback from about it. So I'm just suggesting counseling as another, because I keep saying these like kind of very physical medical attributes, when also counseling fits right in as well. Um, Another thing we can do is we can help people sort out the medications. I I've said this a few times over all these classes. I don't find it my role to help people stop taking their medications. That's not who I am as an herbalist. Sometimes if they're on many medications, we can go over them. And what I might say is, has it been helpful? So I don't do this to protect myself. I do this because I don't really know what medications they can come off of. If I'm working with somebody for a long time, and there's a very good trust and bond between the two of us, a very good trust between the two of us, Sometimes we can discuss their medications and see if some of the medications, sometimes there might be on multiple SSRIs for anxiety and depression, and sometimes they don't seem helpful. And you can make suggestions talking with their, uh, whoever their healthcare providers are about that. But what I can do is talk about the different medications and what they might be doing in their body and why they're taking them. Again, this all offers agency for the individual to just understand how the medical world sees them and what the drugs look to be treating, which can be really weird. I don't know. There's definitely time. I mean, anybody here is a practitioner, I'm sure has happened where somebody comes by and they're taking a medication for a health issue that they seem there's no relationship. It's not even like an off label use. It's just, I have no idea where they're taking it. But I would just say, I'm not sure why you're taking this. Maybe you can talk to your healthcare provider. So other things to discuss with people are their lab values. So meaning, so I work in a clinic, I guess, a medically sanctioned clinic. I have access to their labs. If they send the labs to the clinic, I have access to the labs. And sometimes, not that infrequently, I will go over their labs with them and say, look, you have this elevated, you have this lowered, this is what this looks like. They might have something like a raise in ferritin, and they're concerned about anemia or some other red blood cell disorder or iron disorder. And you might say, well, actually, ferritin's also an acute phase protein that often gets elevated in inflammation. So what I'm saying is understanding labs can allow us to discuss them with people if that's what you want. The one thing with that, though, is it takes time, right? So since people can make as many appointments as they want with me, we can discuss, like, the first time I see them, unless they really want to talk about their labs, I am way more interested in their symptoms initially. I want to know how they feel and what's wrong with them. And then what they could do is send the labs to the clinic. And then the next time we can go over their labs, whether it's online or in person. So I think that's it. I guess what I'm trying to say with lots of what I'm trying to say today is that there's just many ways we could be helpful. And I think one of the ways is being a bridge between holistic health and conventional health care. There's lots of overlap between them. So I'm finished with this section about bridging. I can see if there's any questions about anything I've said, but on the spectacles, and see what we got here. I'm just going to read these. If you're curious about the past classes, Carrie, up in the left-hand corner, has posted the links for them. Yeah, and Andrea, an herbalist in West Virginia, is saying that she also found this about paracycline. Just thinking about this makes me cough. I'm going to cough up worms and other parasites. The parasite thing is really tricky. I mean, I do believe in parasites, and I believe it's Homo sapien. So I think, out of parasites that I know, I think humans are one of the biggest parasites. So not very positive, but this is cynical herbalism here. Yeah, other people talking about muscle testing. Here's a question. In situations where you feel, I'm just going to read it to myself. So here's a really good question. So let's say somebody comes in and they're having a lot of symptoms due to a health condition that you think needs a medical diagnostic. Maybe thyroid, or Lyme is a very tricky one because the labs are very inconclusive often. So if somebody comes in and they think that they have a disorder, that I feel like the disorder needs to be seen and get labs, or needs to be seen by a medical professional, will I treat them initially? And the answer is sometimes yes. What I probably won't do is treat them specifically for the problem. What I'll do is treat them for the symptoms surrounding the problem, and then see if we can help get them to get a medical diagnosis. So that's not always true. I forget, I recently saw somebody that had a pretty serious health condition, and I really didn't want to, I just felt uncomfortable treating them. I really felt like I needed a diagnostic and didn't treat them, but they were already taking medications for other things. So there have been situations where I was waiting for the lab result to come back to treat them. But often what I'll do is I'll just give them herbs to help them sleep better, feel better, all those things that herbal medicine does so well. Yeah, so there's that for that. I'm just going to go try to finish these, and I'm finished. Well, that was easy. So the next one, which will take a lot of today's, really the majority, is patient compliance. Patient compliance. Oof. This is the herbal medicine's one of its biggest problems. So I want to talk about patient compliance. What do I mean by patient compliance? I mean, it's a very kind of a strong sounding word. Compliant means like you're forcing somebody to do something, but it's the common term for this. So what I mean with patient compliance is helping people feel comfortable taking our taking the recommendations and herbs that we offer and actually using them. So I want to spend a little bit of time talking about this, but most herbal medicines, or aside from first aid, most of the people that I see have chronic healthcare conditions that 1 round, 1 ounce, 5 ounces, 20 ounces of herbs may not help. So the goal is to give people plants, herbal medicines, preparations that they will take for a long period of time. Again, the exception is first aid. So I do a lot of first aid. And in first aid, you just try to stop the vomiting or stop the diarrhea or stop the overt pain or stop the bleeding, a lot of stopping there. But in chronic healthcare, your goal is to reduce symptoms and, if possible, over time, actually reduce the underlying problem. I want to spend a minute and just repeat that. So I've often heard, especially in the past, I think, that our goal is always to stop the underlying condition. That's not what my goal is to stop the symptoms and hopefully eventually get to an underlying problem. But it's pretty hard. Like if somebody has chronic headaches or chronic inflammation, it's pretty hard to know what the root of that is. I mean, occasionally you get something right. It might be something in their diet, it might be stress in their life. But often what I'm going to do is reduce symptoms. And sometimes doing that, prolonging that or doing that long enough actually can get to the root of the problem. Yeah. Often it's hard to figure out what the root of a problem is. Life is the root of many problems. So here's the basic mantra of herbal medicine. The medicines don't work unless they take them, right? So we can repeat that over to yourself maybe before you fall asleep tonight. It's probably not always true, by the way. I'm sure lots of herbal medicines, like I give somebody something and they feel good, and just feeling good is enough to like decrease some symptoms. But basically, most of the herbs we have to take, they have to be taken, either put on externally, taken internally, or sniffed up by a steam, whatever it is. So here is why there's often difficulty with patient compliance. Before I go further, I should say the majority of my patients, the people that I see, have not used herbs before. So if you're working in a community of people that can drink hops or mugwort or motherwort tea, you're easy. Like those are disgusting flavored medicines. Even if you like them, they're not technically, most people do not think they're delicious. We get used to them. I mean, I can drink chaparral, right? So here's what I'm always hoping. This is weird to say. If somebody has seen an acupuncturist or a TCM practitioner that gives herbs and they've taken those herbs, we're in the clear, because those Chinese medicinal herbs are often worse tasting. So if that person is seeing a TCM practitioner and has drank some TCM teas, traditional Chinese medicine, often what I'm giving them is not going to be nearly as bad tasting, unless they're doing something like granules. So here we go. So one of the things that's going to be problematic for people who are new to herbs is just it's unfamiliar. I can't really say this word. Unfamiliarity. So let's talk a little bit about this. So what I want to do is a kind of a thought experiment. I'm going to go through what an average doctor's visit is like, and then we're going to compare it with an herbalist visit and the herbalist protocols. So the average doctor visit is about 15 to 20 minutes. Sometimes you can get longer. It just depends on your doctor. But 20 minutes is a good amount of time. Hopefully that's happening for you. Your doctor, even if it's a general practitioner or a family doctor or a PCP, they're likely to ask pretty pointed questions, right? I mean, first they're going to ask you the normal interview questions, do you wear seatbelts? Do you smoke cigarettes? What medications are you on? That kind of thing. Once that section is through, often you get pretty, you say, I have heart problems, and they're going to focus on your heart and chest pain and blood pressure and things like that. So I'm just going to run through this and then we're going to compare. Next is they're probably not going to give you any medicine. What they're going to do is they're going to call a medicine in. So they're going to, maybe they'll tell you what it is, maybe they won't. But basically, they'll call your medicine in, then you're going to go to whoever your prescription provider is, and you're going to pick up your medicine. While you're there, still in the doctor's office, you probably have an opportunity to ask a couple of questions. But usually the questions are going to be very focused on what that health problem is. And then finally, the medicine will likely be tasteless. It's actually not tasteless if you chew it. Chew an aspirin, and you will find that it is not tasteless. But modern medicine has done one thing extremely well, and that's take terrible tasting stuff, concentrate them, put them in a pill that you can just swallow and bypass your taste buds, and so you don't have to taste their medicines. So now we're going to compare that to herbal medicine. So again, a lot of this is just unfamiliar, right? So first, your office may be weird, right? It might not be your typical medical office. That's already unfamiliar turf for somebody who's very much just used to going to conventional medicine. Next, the questions we ask can seem very weird, right? So somebody has diarrhea and you are asking them about headaches. That makes sense to me, right? If you have a lot of inflammation in your body, that can be causing headaches and gastrointestinal disturbances causing diarrhea. One thing that I feel like is helpful is drinking tea while talking to a computer because my voice gets very dried out. The other thing is, if I'm talking to a person and I'm asking them weird questions, and I get the sense of like, why are you asking me this? I can explain why. I can say, the reason I'm asking about headaches with your diarrhea, it could be two things. One, I'm just kind of getting a sense of your general health. You get headaches, because that might be something we want to look at. And the second is, often things are connected in the body. So I'm asking you about headaches for your diarrhea or knee pain or anxiety, because often things could be connected. And what happens sometimes is the connection is made by the patient. They're like, wow, I started getting headaches and diarrhea when I fell off my bicycle, and I had never connected my headaches with my diarrhea. Let me be clear. I'm not really suggesting headaches and diarrhea are always connected. I'm just suggesting that by asking these other questions, sometimes the patient makes a connection, which may or may not be true, that allows both of us, me and them, to set up our treatment protocols differently. Thinking, well, this diarrhea seems very much like it's related to other inflammatory aspects in your body. So instead of just working on gut toners, we're going to work on anti-inflammatories. And the other thing that would be helpful there is if they have labs and trying to figure out like their C-reactive protein levels in their body or other inflammatory markers. So then labs can come in handy, but not maybe necessary. Next, you're going to spend more time with people. So not only the office is a little different, your question's a little different. Sometimes people are not used to sitting there and answering questions. Most people relax into it, frankly, and enjoy having more time. But I'm just trying to say there's a difference, and these differences can make it more difficult for people to adhere to a protocol due to things being unfamiliar. The visits these days at the free clinic are only a half hour each, so not really that different. But I think many herbalists, we see people for an hour or longer. Next is about the herbs themselves. So the first thing is Plants have flavor, and you can't really disguise, you can't stop the flavor unless you do things like capsules, which does disguise the flavor. But tinctures, glycerites, even honeys and syrups, they all have flavor. Plants inherently have a flavor. And so I'm distracted by Carrie's cat for the moment here. Is that the cat we've been treating, Carrie? Sorry, I'll stop there. Um, so I think you just have to let people know that herbal medicine will have flavor. I wouldn't, you, it's difficult to add enough flavoring agents to stop a bad flavor. And the problem with that, by adding enough flavoring agents. So for instance, one of my things to flavor herbs to change the flavor is cardamom. So I tincture cardamom and I'll put it into medicine. But if I add too much cardamom, my medicine is weak because cardamom is not the medicine for them. It's just a flavoring agent. So I think in general, the better idea is just people have to just take it down. So there's a few have to ingest it. There's a few ways they can do this. One of them is by diluting it. It's a very common question. People often ask, can you dilute medicines? The answer is yes. I mean, if you put it in water and drink it, even in a lot of water, um, you still, all the medicine is going in your body. It might be dilute and take longer for it to be absorbed, but most of it, depending on the form of medicine and the plant itself, will be absorbed. Another one that sometimes works a little bit better is doing a chaser. So if they do their shot, their tincture of whatever it is, and then do some juice or something afterwards, that will help hold the flavor down. Rather than putting the herb in the juice, which will make the juice taste bad, is to take it down if they can, and then to do a chaser of whatever feel water, juice, tea, coffee, whatever they want to do there. So we have, the situation feels weird. The herbs don't taste good. Next is we often give more than one herb. With pills, this is easy, right? So you go to your doctor and you have a couple of medicines, you take them 3 times a day. 2 of them you take in the morning, the other one you take in the morning and the night. Many herbal medicines, because of the way they're metabolized and broken down in the body, need to be taken more frequently. For instance, a lot of herbs that help with anxiety are better to take 3 to 4 or 5 times a day. So instead of taking a large dose in the morning, because they're not time released, instead of taking one large dose, is you might have to take it a few times a day to kind of keep enough of that wood betony or passion flower or blue vervain in your body to help maintain your nervous system integrity. This is really difficult for many people, especially anxious people, trying to remember to take the herb. So one thing to do with this is to just ask. So the section I'm talking about now is what to do if do you think the medicine should be taken a few times a day regularly? What I will do initially is just ask them, can you take this medicine 3 times a day? And if they say no, it usually means no. You could try to like push them a little bit, say, yeah, you can. I wouldn't bother. So if somebody gives like a solid, like, I'd like you to take this Nervine tonic 3 times a day, morning, afternoon, and evening. And like, as soon as you hear that, or whatever noise they make from wherever they are, I would trust it. And I would say, how about twice a day? And then they're like, I'm like, okay, well, you gotta have to take it once a day. Okay, I'll take it once a day. You can do this. And what happens if the medicine helps? So you think it's best to take 3 times a day, but if they just take it once a day and it helps, maybe they start taking it more often. But don't set unrealistic parameters for people to take their medicines, because if they don't take it regularly, they're just going to feel guilty and stop taking their medicine altogether. Right? I mean, this has happened for many people. You set yourself a limit to do something, you don't follow it, and then you just give it up because it feels awkward to do it. So ask them, can you take this 3 times a day? If they give you a solid yes, that's easy for me. If they're taking pharmaceuticals 3 times a day, they can, depending on the drug or herb, they can take the pharmaceutical and the herb at the same time. So anyway, One problem is just how many times a day, the frequency of the medicine. The next consideration is if you're giving many medicines, it could just be hard for people to take. Again, if you're taking polypharmacies pills, it's just kind of easy to take 4 or 5 or 6 or 7 pills at the same time. Those nice little containers. You put them in the containers at the beginning of each month, and it's easier to take. You just basically need some water. On the other hand, if you're taking, a tincture for anxiety, you're taking a tincture for headaches, you're taking a tincture for pain, they're like all in 1-ounce bottles. The person might have, if they have a job, are they going to bring them to office? If they're in school, can they bring them to school and take them? So it can be difficult for people to take different types of medicines, especially if they're staggered differently. Like you say, this one should be taken in the morning and night, this one in the afternoon, this one in the evening. It's just a lot for people to memorize. So again, I would talk to them and set up a schedule that works for them. It might not be ideal, but there's that mantra again. Medicines don't work unless they take them. So basically, even if taking in the morning is the only time they'll take it, but you think it'd be better to take in the afternoon or night, it's still, depending on it, still better to take then. In other words, we're working with the individual for that. So all of this, again, has to say is these are all reasons that people have a difficulty with herbs. They have difficulty with flavor. They have difficulty with dosaging, how much to take, how often to take. And so you have to work within that person's schedule and that person's kind of taste parameters in order to get the medicines. Capsules are the easiest way to get by without flavor. If you're making the capsule yourself, it might actually have flavor because it's because you're putting in little capsule slows, and it just takes a while to make, and then you get some powder on the outside. But in general, capsules are one of the easiest to do with flavor. The problem with capsules is they're just very time consuming to make. So, and they're expensive to buy. So that's the problem with the capsules. And many plants aren't best in capsule form anyway, especially aromatic plants, because over time the aromatics get lost as the plant gets degraded into a powder and put into a capsule. Oh, right. So let me see what else. So this is these are these patient compliance parts. So next in patient compliance is also just the language that we use, making sure that the terminology that we speak, the words that we speak are the words that that person understands. I'm not talking about foreign languages. I'm talking about I don't use energetics as a way of expressing herbal flavors. I don't use energetics as a diagnostic. But if you did and you say that this herb is hot or this herb is cold, to somebody who's not used to those terms, they're thinking this herb is sharp flavored like cayenne. They're wondering what cold means. So it just is important to understand, use words that fit into that person's vocabulary of understanding about the medicines that they take. Something that kind of fits in here is if somebody's seen an acupuncturist or TCM practitioner, traditional Chinese medicine, sometimes they'll come in to me and they'll say, I need herbs for my spleen. In general, our spleens tend to work pretty good, unless you have something like mononucleosis, splenomegaly, and a large spleen. There's a couple of conditions. So when somebody comes in and says, I need help with my spleen, I will ask them if they've seen a TCM practitioner or an acupuncturist. And the reason for that is because what the spleen is in TCM is entirely different than this organ in our bodies, right? So the spleen in Chinese medicine has to do with food movement in their body. I'm not going to go into it. It's not my strength. But if, I don't want to give them herbs for their spleen, if they're talking about kind of the Chinese concept of spleen, which will often have to do with digestion. And so then I'm going to ask them questions about their digestion. This brings me to another topic while I'm on this roll. That is, often people will come in with a diagnostic. I'm off patient compliance for a minute. When people come in with a diagnosis, whether it's Lyme disease or, I don't know, rheumatoid arthritis, um, herniated disc, it's just really helpful to ask them what are their symptoms. There are herbs that sometimes help with the diagnostic, um, but often what we're really looking at is trying to help them with their symptoms. So I just want to say that when somebody gives me a disease, they say they have Lyme, actually doesn't tell me, it tells me that they have the bacteria called Borrelia burgdorferi in their body, but it doesn't say what's wrong with them. So what I want to know is what are their symptoms? So again, a little bit off topic, but it's just something to consider. So all this to say that it's trying to help people feel comfortable by language that you use, by working within their parameters of what's acceptable flavor-wise, um, and how frequently they can take things. What I really think is helpful for us is to like think for a moment, what's a doctor's office? What's a doctor's visit look like? You know, you kind of go into the reception room and the waiting room, and you get these forms to fill out. You see the doctor for a certain amount of time, and then think about what you do. The reason I'm saying this is it just allows you to see that while we offer a very valuable service, for many people, it's an unfamiliar service. And and then you think, well, how do I make this to a comfortable time, a comfortable consultation for the individual? Almost finished with patient compliance. Some of the trickier things to take, besides things that are flavor, are external preparations. Salves, ointments, lotions are pretty easy, but particularly difficult are compresses. So we have two things that sound alike: poultice. Well, they don't sound alike. They act alike. Forget it. Poultices and compresses. A poultice is when you take a plant and crush it and put it in your body. So the most common poultice is what's called a spit poultice. You get stung by a bee, you're not anaphylactic, you pick some plantain, you chew it, and you put it where the bee stung you. That's a poultice because you're applying the plant directly on you. In clinic, I rarely use poultices. They're very messy. It's difficult to keep a plant on your body. More commonly, I'll suggest compresses. So a compress is when you make a tea out of a plant, put a cloth in the tea, and put a cloth in the body. So compresses could be great for a whole bunch of different kinds of pain. So one thing I found very helpful is I've just made a handout on how to do compresses. So I'll make it up. Like say it's a ginger compress. We'll get the ginger out and pour it in a bag. Um, and sometimes I have extra hot water bottles. One thing that really helps with compresses, by the way, is a hot water bottle, because that way you don't have to keep reapplying the heat. So if you put a compress, you have a pot, there's herbs in it, you put the cloth in the herbs, the tea, you put the cloth in the body, and by the time it's on their body, it's cooling down within 2 minutes. It's cooler than you want it. So one thing to really help is to just get a hot water bottle, make sure it's not too hot, and put that on top of the towel, on top of the compress, and that'll help hold the heat in so they don't have to change it as often. Um, so, but what I really find helpful, without going into the specifics of a compress, is just telling people, here's the directions how to make a compress. If you have any difficulty, talk to me at the clinic. They write the clinic, and then the clinic will send me, and then I can communicate with them via email or some other method to let them know how to make compresses if it's helpful. Compresses are also just really messy. I mean, if you're trying to put a compress, a very common compress is going to go into like your upper back or your lower back, and they're really hard to put on by yourself. So often you need a second person in there. I would also suggest having a dry towel underneath them because they drip. And if they're laying on a bed, that bed's going to get wet potentially from the compress. So anyway, it's just trying to help people. Neti pots could be another thing, is discussing with them how to use them, and how to, and so another thing that we sometimes doing steam inhalations by putting essential oils in water and just having specific brochures and directions on how to make it and making yourself available, not 24 hours, having make yourself available by email or whatever method so that people can let you know what's not working and then ask you for that. Um, yeah. So not all these things are very different than medical suggestions and going to a doctor's office, but all this comes down to what I've just said previously. Realize between seeing us, herbalists, and seeing doctors, and even if you're a nurse or a physician assistant or anybody here, often when you act as an herbalist, it will still seem a little bit weirder than your MD practice or your PA practice. So I'm almost finished. Um, I'm going to look at the questions, if you have any questions about what I've covered, and then I'm going to go over just a little bit more, some warning signs, and then how to learn some of these skills, and then I'll be finished with this. Karen asked, recommending a heat pad because of the electromagnetics. I think heat pads work good. I don't really know that much about electromagnetics, positive or negative aspects to them. But the one thing about heat pads is many people have them. And so it just saves money. So they're easier to use, right? Because a hot water bottle, you have to if you have to buy one, you have to buy a hot water bottle. I don't know who's bought a hot water bottle lately, but often they stink of rubber for the first couple of weeks. So, so you have to like air them out. So it's just a problem. And often they're like the shape of fish and unhelpful shapes. Anyway, enough about hot water bottles. So actually, I do recommend when people say I have a heating pad at home, I suggest it. It's just easy. I kind of like the moist heat of the hot water bottle better. But if they have a heating pad, I would go with it. It works. It keeps that towel warm, which is what we're looking for. Michael asks, I understand meeting people where they are. Can you speak to? Sorry, I start loud and go soft. Oh, and BJ is mentioning the bean bags that heat in microwaves. Excellent. All those rice and beans, you just want to put heat. So those are excellent ideas as well. I should have mentioned them. Thank you. Michael asked a kind of a tricky question that kind of fits into this whole parameter, which is how to encourage people to do more for their health. Woof, 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 woof. Um, I think the way to help to encourage people to do more for themselves is by initially developing trust with them as a practitioner. So in other words, the first time or two or three that you see them, it will be difficult. Uh, unless they do, some people will do lots for themselves, but lots of people won't. It's time. It takes time to do these things, especially like a compress. So I think the best way to encourage people to do more for themselves is you develop a trust with them and they see you regularly. And over the course of time, like setting that in motion kind of sets them putting time aside to help themselves. And then I think it gets easier to encourage them to do more. But some people won't. And I think you just have to accept that and then work at their level. I think that's what I would suggest for that. But it's a tricky one. uh, Michael, one more question from Michael here. So I talked about boundaries in a previous class. Um, the question is, how do you get people not to speed dial you every time they have a question? Some people will. Some people, as soon as they have a problem, or they will call you. So the first thing to do is to not give them your phone number, would be one way to do it. I do a tricky way, which won't be available to everybody, is everybody I see at the clinic writes to the clinic, and then the clinic writes to me, and it kind of slows down the process. If somebody is calling you regularly, you just have to be clear that you have a life as well, and that you don't have time for them all the time, and then set parameters when they can call. Um, I haven't had this as a problem very frequently, by the way. Most people I feel are fairly respectful. when people call me at my home, my phone number is all over the place. And I tell them I'm at home. Occasionally they'll start telling me their health issue, and then I'll just say, let's make an appointment. And even though they'll keep trying to tell me their health problem, I'll just be very clear. I work at the free clinic on Thursdays from these hours. Please make an appointment. I am watching The Pit, and it's way too intense for me, and I probably should stop watching it tomorrow. So that's what I would answer to that. I'll look at one more. So Kayla asked a really good question as well. What to do when people come to me or you and specifically want to get off their medication? Um, it depends on what their medication is. So if somebody wants to come off their blood pressure medications and they have really high blood pressure when they're not on medications, let's say 175 over 100, I won't help them get off their medications. I don't want to be involved in their blood pressure spiking and causing a stroke or a pulmonary embolism or whatever heart disease might occur from that. If people are on SSRIs, so Kayla, what I'm doing is just being very specific here. If people are on like antidepressants and they don't seem suicidal, that's going to be a call that you have to make. I will talk to them about it. I have to say, I am pro SSRI. I'm pro antidepressants. I've met many people where it's helped. I've met many people where it's made worse, and I've met many people where it's neutral. So when somebody comes in and they're taking, again, Lexapro, whatever they're taking, so Alexa, whatever, and I'll ask them, has it helped you at all? And they say no, which is not that uncommon. I'll say you might want to consider coming off it. One way to do it is to titrate their doses, is to cut their pills in smaller pieces. And they often can't really talk. First, they can't really talk to their doctor because they have to make an appointment, which may take a long time, and they have to pay for it. So like talk to your healthcare provider is a good suggestion, but might not be a practical suggestion for financial and time limitations. So I think I'm just going to make a little bit of noises. If I'm going to help somebody getting off a medication, I have to have a relationship with them. No matter what it is. So if somebody comes and the first time I see them and they want to come off something, I'm just going to say I'm uncomfortable with that. If I have been working with them for a long time and I know who they are and kind of the problems that might occur, I'll feel much more comfortable. So, but sometimes I just tell them that I'm not really the herbalist to come to get off your medications. And then I'll talk to them about their health issues. So it's really kind of how to help people get off their medications is all over the place. I have worked with people that I have suggested, like, this is not working for you, especially if they're taking it as needed. Then it's much easier. So taking Ambien for sleep, and it's not helping them or making it worse. If they're taking it as needed, then you have more options because it's not like building up in their body and stopping it will be a problem, especially if they're not taking it frequently. So it's really kind of all over the place in what to do when you're helping people trying to get off their medications. But again, it's not my goal with people, at least initially. All right, we have one more section to fill out here. This will be the end of this. Thank you for being here today. I know you could be flying a different airline. Who wants to be on airlines these days? Oof. So, and I'll look at the last few questions. So here are some ideas about how to learn these skills. None of these are going to be that helpful, but here we go anyway. The first thing is never stop studying. I started studying herbal medicine in 1981. I know a smidge. Really, it's just there is so much to learn about each plant. I mean, today I'm studying. What am I studying about? Skunk cabbage. And I realized like I just need to learn a lot more, and it's really hard to find good information about how to use skunk cabbage. So that's just like one plant for one or two situations, and then there's the pharmaceutical stuff, the counseling stuff. So first thing I'm saying is you're going to be studying the rest of your life if you want to be good at this. Next, really helpful is networking. This is it's kind of a self-promotion thing, but I would suggest going to an herb school that's in person, if at all possible. So online schools are very important. Many people can't leave their homes for lots of excellent reasons and go to an herb school. But I can tell you, having run an in-person herb school, is the network is much stronger. So you can network with people, but if you do an online program, try to find one where you meet every few months anyway. Get to know people. Those people might be a part of when I studied, there's still somebody I talk to a lot who I studied with Michael Moore in 1995, right? There's actually a few of them. So those networks are really helpful. And that way you have a place to ask the questions, these kinds of questions. You can, there are some Facebook groups, and some of them aren't terrible. I mean, you can usually figure out which ones give practical advice and which ones are just people speaking from non-experience. But you want experience. Next is be patient with yourself. You just get better with time. Usually you're going to feel like you have the best skills like the first year of practice. When you're first practicing, you think like you know a lot, and then it's like, being a teenager all over again. And then you realize very quickly that there's a lot to learn and you are a beginner, as is we all are. So it's a continuous learning process. There are many skills to learn that are not specifically herbal. You can take counseling classes and learn more about counseling. You can take medical classes and learn about specific diseases. So you can flush out many of things that are not specifically herbal without going to herb schools. As far as counseling, as far as like this, what this class has been about, what I suggest, it's not going to be easy to do, is find a practitioner and ask them if you can sit with them. They could be a dentist, probably not a dentist, but they could be like any kind of practitioner. It could be a doctor, a PA, a PT. If they have skills that you think are helpful, sit with them. They don't have to be an herbalist at all. And then you learn the art of counseling. So again, they don't have to be like a counselor, but if you go to a PT, a physical therapist, and you think, wow, this person has really good skills, you can ask them if you can sit with them. They are going to want to know, potentially the most important thing is that you hold confidentiality important. Like, because one of the bedrock features of healthcare is confidentiality. Like that trust is so bedrock. It's so important. So I would suggest if you know anybody that you like their skills, ask if you can sit in, and maybe you can do a trade with them. You can bake them something. You can bake me something. But you can let people know, that you have to somehow prove to them that you're trustworthy, that because you're going to be seeing real people in real time. I do an apprenticeship where I have two students at pretty much most times with me in the clinic, but they're not the regular students who go to the school. They're specifically selected by me, and we do work trade for that to sit there. So as I start to finish up right now, I am going to do a little self-promotion. So I run an herb school called the Northeast School of Botanical Medicine. It is an in-person school here in Ithaca, New York. I'm taking this year off because I want to drive to Nova Scotia. So, if you're interested, if you go to my school, Northeast School of Botanical Medicine, I'm going to start it again in 2026. I've been doing it since 1992. I just had my 67th birthday, and I'm probably only going to do it for 2 or 3 more years before I stop running a school, at least an in-person school. But I'll be starting again in May of 2026. I am already interviewing people. That's my biggest one. The next one is free. I'm a clinical herbalist at the Ithaca Free Clinic. We'll see anybody in person or telehealth. That means online. So if you want to see me as a person, you could make an appointment with the Ithaca Free Clinic. It's very easy. Just go to the website, Ithaca Free Clinic, and ithacahealth.org. But if you type it in, you'll get there. Just don't call me on my phone here. I don't make appointments. I do want to say, though, I don't send medicines to anybody. So I will make recommendations, but I just don't send medicine. So no matter what your needs are, I'll tell you what medicines I think are important for you, but you'll have to figure out where to get them. We can make some suggestions, but I just won't send them to you. And the other, I already said, the 7-song herbal database by me and my buddy Steve will be, I'll start on Facebook and Instagram saying, and it's just on my website. So if you go to my website, which is 7song.com, I'm writing number 7. But also on my website, I have lots of free stuff, lots of handouts and blog information. Really, at this point in my life, uh, I've spent since 1981 studying herbs, and I want to, I had a lot of words coming out of my mind that most of them I shouldn't say online. I want to give this information and make sure that it's helpful in as many ways as possible. I don't want to have spent my life studying herbal medicine for it to just die with me, frankly. I want to make sure that it gets explored and people can use it and it becomes practical and I can be a clinician for people and all of those things. I'll read these questions, and if there are any. Um, no, I don't see many questions. I'm studying in Nova Scotia. Is NS Nova Scotia, BJ? There's Ethical Free Clinic. I think that's it. With just a few minutes to spare. Thank you, everybody, for being here. I appreciate a few people being live, and so I can at least see some faces. If you have any questions, you can ask Carrie in the left. Again, Carrie's cat. So if you need an herbalist in Buffalo, New York, Carrie is an herbalist. Uh, the, she's under Aurelia's school, if you're looking for somebody there. And if there's other ways that could be helpful, you can let me know. And I think that's it for today. Thank you again. I hope this series has been helpful. Back to you. And thank you. And goodbye. Enjoy spring. And I'm trying to figure out how to stop the recording.